Welcome to the RX Physiotherapy Podcast, your go-to destination for all things physio, rehab, health and wellness. I'm April Patterson.
And I'm Brendan Chase.
And each week, we will dive deep into fascinating topics within the health world. From physiotherapy to nutrition and beyond, we cover it all. So sit back, relax, and enjoy the journey as we explore the exciting world of health and wellness.
And before we begin, we'd like to acknowledge the traditional owners of the land which we meet today, the Dharawal people, and pay respect to elders past, present, and emerging.
Let's get started. Hi guys, today we're going to be talking about the TMJ, also known as the jaw. So it stands for temporomandibular joint, and that just notes the two bones that are connected by the muscles at the jaw. We're going to go through the anatomy, we're going to talk a bit about clenching, then we're going to dive into some neck stuff and how that affects the jaw. We're going to look at how your posture affects the jaw, and we're going to finish up with a bit of TMJ and hypermobility information.
As always, hypermobility creeps its way into every one of these podcasts, which is for the best.
Yeah.
The point you brought up right from the get-go there is how the muscles attach the jaw to the skull.
Yes. So the jaw is the one joint that actually dislocates when it goes through its range of motion. So it requires a lot of muscular and ligamentous stability to stop, over dislocation. So, when the muscles are angry, they get very angry.
And it's another group of muscles similar to, say, the heart or the calves or even lower back, which rarely get time to rest.
Yes.
They're constantly, whether we're talking, we're chewing, swallowing, or if we're stressed, they rarely get time to relax.
Exactly right. And we know that when the neck is not strong, or if the neck muscles are so overloaded from bad posture, then you're going to get the jaw muscles over clenching, which is essentially like squeezing a fist for an entire day or days on end. Mm-hmm. And how sore you would feel if you did that. That's what you're feeling into your jaw. But at the same time, we're also using our jaw to eat, which causes a lot of force through those muscles. We're using it to talk. We're using it to breathe at times. So it has so many different functions.
I think I can't remember the actual statistics of PSIs, but I think we're capable of quite high bite force as well for humans.
Yeah,
because
definitely.
We're omnivores, we still have to chew through meat.
Yeah.
And I've definitely met some people who you can see their jaw muscles are protruding through their cheeks.
100%.
And it makes sense as to why, if there's some dysfunction there, that it causes problems. Because it's not just about strength, there's definitely a lot of coordination that goes on there too.
Absolutely. And
the point about how the neck plays a big role makes sense, because how often do we see people who tend to mouth breathe a lot?
Yep.
Or people in more athletic endeavours who really widen, get that yawn posture, like Olympic weightlifters who try to find stability anywhere they can.
Yes, exactly.
And now we're seeing it in more the powerlifting circles as well, where they have these specially made mouth guards that don't have any space at the front, so they can just clamp down as hard as they can.
Yep.
And as my final adage, because I feel like I get lots of examples really quickly.
Yeah, it's good.
There's an old saying is when you bite down on a mouth guard. So you say if you're going into a match where things are going to be rough, you bite down hard to protect yourself. And even that's going to build more stability in your neck and also give you something to feed back off of as well.
Absolutely. Yeah, definitely. We know that the jaw has a huge impact on the first 3 vertebrae of the neck. Oh. So it's going to have a huge stabilizing effect. So I totally agree with you. When you look at these athletes, powerlifters is a good example, they have huge jaws to help them to stabilize their neck.
They talk too much too.
Lots of rest.
Well, speaking of, we'll have to get Alex in here one day. Or we'll just link this to him and say, hey, we gave you a shout out. Alex from South Coast Strongman and Barbaric Strength.
Aww.
Who knows his stuff, that's for sure.
He definitely does. He is very good. And you've got to know your stuff with powerlifting, because...
Otherwise it's so easy to get hurt.
Yep.
In saying that, and we've gone off on a tangent already.
Yep.
In the fact that all those guys have little aches and pains, which is normal.
Yeah.
And people think, oh, it's unhealthy. Hey, plenty of things are unhealthy. When you're pushing that close to your upper limit, it makes sense. Your body's going to let you know, hey, we're getting close here.
100%.
But we're definitely, I think today's far more aimed at, actually, do you want to cover everyone today?
Yeah.
Do you want to go through the general population of jaw pain to the more athletic people, to even people who like post-traumatic stuff?
Yeah.
I think that's a good idea. We got time.
Yeah, let's do it.
Cool. Why don't we start with, I think we've already touched on the kind of run-of-the-mill people.
Yeah. Yep.
And we'll go into that again later with like stress and like teeth grinding and stuff like that. What about those people in the middle? So people who have like been in a car accident, or suffered an assault, or had a fall and knocked their chin, or something to that manner. Have you ever seen patients like that before?
Yeah, I have, and it usually manifests as the individual having imbalances in the jaw. So one side of the jaw will be really tight and actually have a larger muscle bulk, and the other side will be weaker. Generally, they'll actually feel the pain on the weaker side, which is
such a head screw.
Yeah, exactly. So you'll see these individuals, they will have, like when they open their jaw, it will deviate to one side more so. You can see that there's extra inflammation on one side of the face as well too.
It's like to be tended to touch too as well.
Yep.
Sometimes the close side, sometimes the far side, sometimes both.
Exactly.
I haven't really found a rule of thumb with that as yet either, but definitely that fact of it's painful on the weaker side.
Yep. Yeah, exactly. It's interesting when you watch these individuals. This isn't just people who've had traumatic injuries. This can happen outside of this, but this is generally what I've seen. Is when they open their mouth, it is going towards the side that is more bulky, away from the side of pain, and you can almost think about it like, because it's it dislocates when you open your mouth. On the side that's painful is being dragged out of its socket slightly, so it's giving pain so that you don't extend that position, basically.
So why don't we, to reiterate, we're talking about those people who, they've had that initial injury, very sore, very sorry for themselves, things calm down after a couple of days, and then they're left with a jaw that's just not functioning as well as it could.
Exactly.
I've got a patient right now at the moment who actually, they showed me the video when it happened. They got clocked in a tackle and they just got headbutted on one side of their jaw. And yes, if you're thinking this is you and you're listening, that's definitely what I'm talking about, without saying any actual names. And you could see they were quite stiff in the jaw, and opening, they would only shift to one side, and they got hit on that side they moved away from. So, which in a way doesn't make sense. You would think there'd be like a reactive spasm going towards it, but obviously it just got shifted, everything crammed up on the far side. So yeah, and I guess after that then, it comes, I guess you would say it kind of turns somewhat more run-of-the-mill. So going more to those general people again, to where it's much more about, alright, we manage their pain, which is really, there's a lot of self-management in there as well. There's also a lot of stuff we can do in the clinic that really helps too.
Oh, absolutely. So because you've got all that muscle mass holding together the jaw, and if one side is just really overactive, you can use different strategies to wind down that muscle contraction on that side.
Turn down the volume.
Exactly. And start to get your body comfortable with chewing on the other side again, so chewing on the actual painful side. There's heaps of stuff like to increase the alignment and reduce the compensation strategies. These people tend to do quite well if they get treatment quite quickly.
Yes.
If it's a long period of time, you can end up with things like disc injuries. So between the two little bones, you've got a little soft cushion that is called a disc, and when the jaw opens and dislocates, it glides with it to stop the two bones basically from rubbing against each other. If you have an imbalance in the jaw for long periods of time, that disc can actually get too stretched, and it can either slip over the bone when you move, or it can actually go in front of the bone. So you either see that person that has a really clicky jaw on one side because that disc is now not locating properly, or that person that actually ends up with lockjaw and they can't open their mouth.
True lockjaw.
Exactly. So that's more of a chronic presentation that can happen if you don't get on top of it. when it first starts to present. But yeah, that's usually what I see. Do you
Yeah.
agree with that? Yeah.
But another one of those kind of the human body doing our job for us is when, especially in those chronic presentations, that, and this isn't everyone obviously, but if you wait long enough, the tendon behind that disc actually thickens up and it forms a brand new disc.
I'm really glad you said that actually, yeah.
It's popped in my memory from what we talked about before, and the fact that it will find a way. It may not be perfect, but we definitely see people, even on imaging as well, where they're like, oh, my pain went away after a number of months.
Yes.
It did take a while.
Yep.
And they say it's still not perfect, but it's better than it ever has been. And that's when they're like, okay, there's some light at the end of the tunnel, and that's when we can jump in and kind of find some ways to get them the rest of the way as well. Which is one of those, once again, the human body is crazy in some aspects and weirdly fragile in other ones.
Absolutely.
The fact that it can it adapts to what's needed.
Yes. So true. Yeah. One of my close friends, she won't mind me speaking of her on here.
We'll get to sign the NDA later.
Yeah. She had a lot of issues with her jaw growing up. She got to the point where she had lockjaw, and she went to a physio. This is when we were about maybe 16, and they were like wrenching open her jaw. This is a good example of when you have true lockjaw, you can imagine it like a stuck door. You can't push it open. It's something that needs particular approach to it. Definitely don't try to force it open. That's what I'm trying to say, because that won't make it better. There's some things that can really affect people's function when you're looking at the jaw.
Massively.
Yeah.
And then we can even dive into stuff like, of course, it's going to make eating difficult. That's a big one.
Yes.
And then talking becomes painful.
Yep.
And just those two things alone make people withdraw. So that's where we get into that kind of mental health side of things, and then there's this kind of vicious cycle that people get more stressed, more affected by this element, and then that just feeds into itself over and over again, because we know how much stress relates to the jaw and the neck as well.
100%.
So for something so simple, and for something that not a whole... do you know the stats on it at the moment about how many people suffer from TMJ dysfunction?
Before COVID,
That's
sure
right.
that
They
it
went up
was.
quite a bit.
Yeah. I don't know the incidence of the total population, but I know that it's like gone up by about 4 times.
That's insane. For anything, that's a big increase.
Yeah.
But it also makes sense.
Yep.
People losing jobs, people struggling with money, people being stuck at home for the first time in years.
100%.
I also know that divorce went through the roof as well, which is kind of sad.
Yeah.
Because then on the flip side, pregnancies went through the roof as well.
Far out.
So it was positive and negative.
Wow.
COVID. It's amazing we're still talking about it.
So much fallout. Yeah, this is a good segue into clenching. So,
Absolutely.
yeah, clenching is by far the hardest thing to treat with TMJ. When someone's pain is driven by clenching, especially nighttime clenching, because it's a subconscious thing when you're sleeping, it is really hard to break the cycle. And some people have huge results with meditation, deep breathing, visualizing the actual muscle to relax.
Mm-hmm.
There's some really good evidence on that. But the sleep time clenching is a really hard
Your
one.
body's going to do what it wants to.
Exactly.
And we know some people do really well with splints, but splints aren't about, and we've only just recently learned this too, is that it's not about stopping you from clenching, it's about stopping damage to the teeth.
Exactly. Totally.
So it's not fixing the problem,
Yep.
it's just stopping it from causing more dental issues.
Exactly.
Which is good,
Yes, definitely.
but we're still left with this other stuff.
Exactly.
And I feel like you already touched on that point as well, the fact that it's so stress related and looking after more self-care stuff and mental health and de-stressing from the day.
Definitely.
It's not perfect because we can't just say, oh, go meditate or go for a walk,
Yeah.
and that's going to work for everyone.
Yeah.
It takes time to figure out what works for you, and that's going to
Exactly.
change too from if you change jobs or if you move houses or have kids or the kids move out, which I would assume would make your stress levels much lower.
Yeah. Oh.
It's just about finding what works for them.
Yeah.
And sadly, it's not an instant fix either. You have to give it time. You have to give it weeks, even months of really consistent effort of those more down-regulating tools
Definitely.
before you see a difference.
Definitely. So true.
Which is frustrating, but It's also free.
Yes, yeah, exactly.
That's the big thing.
Yeah, exactly. There's quite a bit of evidence to suggest that the nighttime clenching, you can almost consider it like a report card of your overall stress levels.
Yeah, okay.
Yeah.
Yeah, that makes a lot of sense.
Yeah.
That's have you ever suffered from clenching?
Yes, I have suffered from clenching, especially when I was really stressed at uni, and yeah, it was really hard to manage. You're waking up and your teeth are sore because you've been clenching so much, and
here we go again.
Exactly, and it just constantly consumes you. You're trying to concentrate, but you've got this pain that's so close to you because it's on your face.
Yes.
That
Which is something we're just not used to.
Exactly.
That sounds quite rough.
Yeah, it has a huge impact on your life. So yeah, we totally understand how much it does impact your life. But today I don't have any pain. Like I might, it's always in proportion to an event, and it's gone within a few days.
Because in the past we've worked on your neck.
Yep.
And we found that you actually have a referral pattern from one side of your neck to your jaw, was it to your ear?
Yeah, to my jaw.
So that kind of, once again, another excellent segue.
Definitely.
Of how much the neck plays a role in this as well.
Oh, that is a great
sometimes
segue.
it's purely neck.
100%.
And they think, oh, I've got lockjaw, or I've got all these problems with the jaw, and you assess the jaw and you're like, it looks pretty good.
Yeah.
And there's no real problems there. They've got no clicking, there's no deviation, they don't have like a big muscle bulk on one side. Then you look at their neck,
Yep.
and it's either stiff as a 2x4,
Yep.
or they've got way too much motion either side.
Exactly. Yep.
Once again, I wish we could just tell everyone to just stretch or just get stronger when it's not that easy. It has to be specific for the person.
That's so true. So even so, like I was very stressed at uni at the time, but I was also doing a lot of CrossFit and overhead workouts. So I was getting a lot of headaches at the same time. I was getting a lot of neck pain, and I wasn't conditioned to do what I did at the time. So I think that, yeah, you're correct. That had a huge impact, and me being more educated now on that. I still do stuff overhead. There's something wrong with that. It's more about working within your capacity
At that time. Because when we're in holidays,
yeah,
you throw a lot more stuff at yourself and you can tolerate it.
That's right. You got more rest.
But when there's like a stressful, like I know when the gym was opening here,
yeah,
new location, Hustle Heart Health.
Yeah.
You and Taryn were both. Taryn still kept up with his training.
Yes. Yeah.
Where I know if you had fell a fair bit off, and you
Definitely.
noticed it yourself too.
100%, definitely.
Where it makes sense. No one's superhuman.
Yeah.
We're not, and we talked about this before, where more is not more. Sorry, more is not better, it's just more.
Exactly.
And it's easy to push yourself over the edge.
100%.
And so again, the overhead stuff, we should all be overhead pressing.
100%.
It's a functional pattern. We need to do it. If you can, if you get any pain overhead pressing, neck, shoulders, whatever, it's definitely something to have a look at.
Yeah.
What about if we go into how the neck contributes?
Yeah, so with the neck, if the neck is not strong enough, or say if you've got a really tight upper back and your head is just forward,
definitely.
You can think about holding a fist away from your body. It's a lot harder than if it was close to you.
Mm-hmm.
So those muscles are just having to hold this bowling ball at a higher amount.
8 to 12 hours a day.
Exactly.
Much longer level length.
Exactly.
And then from that as well, we often notice people in their actual upper back just get stiff.
Yep.
So not just the muscles, but the actual joints themselves start to, because they just don't have any movement there.
Totally.
And once again, they're asking their body to do something.
Yeah.
Which is, hey, I need to stabilize my neck.
Yep.
And the upper back just goes, yep, we'll just lock everything down,
Yep.
joints, ligaments, everything, and that'll do the job, but it won't feel good.
Exactly. Short term, you'll survive, but long term, you're going to end up with all these imbalances. And yeah, so when the neck is not able to cope anymore, it's going to start to enlist the jaw. Let's basically put
That's
it like
a
that.
really good way to put it, in the fact that and we often see more, I want to say I've seen more like neck related to upper back. And then it always seems like once it's gotten all it can out of the upper back, then it goes to the jaw.
Yes.
So it goes downstream first, then upstream. I rarely see it go from neck straight to jaw.
Definitely.
There's almost always some, it doesn't mean you have to have like bad shoulders or anything. It just might mean like your rhomboids and middle traps just aren't there, which is a hard muscle to isolate for everyone. It's such a strange thing, the fact that once again, like you said, short term, your body just wants to get to the very next minute.
That's it.
It does not care what's going to happen next year.
No, exactly. That is so true. And so some people who have jaw pain, they have no neck pain, but when you look at it, you're like, yes, your neck.
Yeah, exactly. And
your neck is the
that's
issue.
the killer, is the
in
fact
your
that
upper back.
sometimes you're like, yep, your jaw is just a symptom. There's nothing actually going on there.
Yep.
Which is, for the people that come on board with you and realise that, it makes things so much easier. For those people who are like, no, it's definitely my jaw. I'm like, I'm not saying your pain's not there.
Yeah.
We're just saying X, Y, and Z are the causes for it.
So true. It's like the jaw's going, this is not my job. The pain is like the jaw in protest.
Like,
Like,
the jaw has
excuse
such
me.
a tiny voice as well.
We might leave this one here today.
I think so. Why don't we do
Wrap
this
it
as a
up?
two-parter, because we can dive
Yep.
a bit deeper into this one.
Yep.
What if we do very quick random fact for the day, April?
Do you have one?
Starfish wrestle for territory on the ocean floor.
Wow.
I know, how silly is that, by the way?
I mean,
You can look it up. They literally have these tiny, tiny, slow-moving wrestling matches where they'll be like, yeah, and then one will just give up and slink away. And the other one will just stay there, victorious. I'm like, that was the most... What's the way to put it? The gentlest fight I've ever seen in my life. Especially in the animal kingdom, which is crazy. But no, look it up. It's crazy to watch, because obviously all these videos are sped up.
that's true. Well, I know what I'm doing now. Oh.
Alright, everyone. Tune in soon for part 2 on TMJ.
Bye.
Bye.